What's up everyone, Carl here, and in this video you are going to learn how to crack your knee with a simple self-adjustment that's going to help you mobilize your stiff, achy and uncomfortable knee. And stay tuned towards the end of the video where I'm going to show you how to dynamically control and strengthen that pesky knee problem so it's not an issue in the future. Let's do it. Before we begin, I have taken the time to actually chapterize this video, which means that you can skip ahead to the parts that you're most interested in, and you can find the links for that in the description below. Now, before we jump into the three simple mobilization and strengthening movements that you're going to need to do for your problematic knee, I want you to understand that these techniques are not for the more serious knee issues such as ligament damage or meniscus injuries. For those sort of things, you're going to want to find and talk to your chosen medical provider for some tailored guidance before you start any exercise programs. So you've got a stiff, achy, problematic knee that maybe builds from a dull ache into some sharp sensation when we walk or run for a prolonged period of time. Now, if that's the case, then you might actually have a tibial rotation problem. And it's the tibia, which is one of those bones in the lower leg that actually should have a degree of rotation with the knee when it's in a bent or flexed position. Now, as the knee extends and comes to a more straight and strong position, there should be a lot less rotation. Biomechanically, what this actually means is, as we walk, we should have a degree of this rotation through the tibia. However, if there's an issue with the biomechanics, most likely coming from the hips or the pelvis or even the ankles, then the knee begins to take a little bit of that strain and it will begin to move in ways that it is not designed for. Now we're going to get into the three simple techniques which are going to be knee mobilizations, which are going to encourage that tibia to rotate rather than fixate. So let's do that now. So the first technique that we're going to look at that is going to mobilize that knee, which is going to be a self-adjustment technique, we're going to need to lay on our back on a nice firm surface. You can do this on the floor, or if you have a table, you can do that there too. You're also going to need a towel. A small hand towel should be perfect for you. So you're going to take a small rolled up hand towel, and as you lay on your back, you're going to place this hand towel behind your knee on the affected knee side. Then you're going to hold your shin just below your knee and below that hand towel, and you're going to begin to apply some pressure as you draw your leg towards your head. You can actually lay back into this. This is going to help a little bit. And what we're going to do, this is actually going to create a beautiful small lever action on your knee, which if it is slightly out of alignment, it is going to create a pop feeling in the knee. It is definitely going to help release that fixated rotation that we're trying to work on. However, if it is painful at any point, please do stop and consult your chosen medical professional. Now, we're going to repeat this action 2 to 3 times, and we're going to hold that tension for 15 to 20 seconds each time. Now, if that wasn't quite deep enough for you, what we can do here is we're going to find a nice strong flat surface. I'm going to use my chiropractic table. You can find anything similar to it. You could even do this on a chair. You're going to place your shin flat onto that surface. And we're going to now take our hand, and it's going to be the same hand for the same side of knee that we're working on. So if it's your right knee, we're going to use our right hand. Now we're going to place the flat of our hand directly behind our knee. We're going to sit backwards and down into this position. This is going to slowly increase and create pressure through the knee as we do this. It's effectively allowing tibial rotation to occur as that pressure builds. Now, to make this a little bit more dynamic, what we're going to do here is we're going to quickly drop our body weight downwards So if the knee is a little bit more fixated and it didn't go pop with the last technique, this is actually going to create more of a dynamic movement through that fixated knee. And it's very likely that we're actually going to have a pop or a crack at this point. So if that happens, that is good. Again, if there is any pain at any point during this technique, please stop immediately and consult your chosen medical professional. So it's not all about making things go pippity pop. Sometimes we have to strengthen and stabilize these joints. So it's really important that we work on dynamic control through this tibial rotation. But before we get into that, if you haven't already done so, hit that like button. Let me know that this content is valuable to you and I'll keep making it for you. Now, with this dynamic control of internal and external rotation of the tibia, we actually need to sit down to do this, because as the knee becomes fully extended, we actually have a closed pack formation where rotation of the tibia should be minimal or non-existent. So we need to have bent knees. So find a chair or find a chiropractic table if that's something that you've got. And what we're going to do is sit down so our feet are nice and flat on the floor. Now, with our heels on the floor, we're going to lift our toes and we are going to slowly and in a controlled fashion rotate the foot outwards all the way, and we're going to be focused on keeping our legs above the knees completely steady. Now, as we extend outwards, we get to the end range and we're going to slowly rotate back inwards. It is important that we do this nice and slowly, because this technique is easy to do quickly, but we're working on control. That was our knees bent at 90 degrees. And as I previously said, as our knees straighten, we lose some of that rotation through the tibia, and that's a good thing. However, for the next thing, we are going to extend our knee or extend our legs outwards, so our knees are in a sort of 45 to 60 degree position, rather than the 90 that we were in before. And we're going to repeat the same process. So our heels are on the floor. We're keeping our upper leg or our femurs nice and stable. We can do this by placing our hands on it. And we are going to focus on externally rotating the feet as far as we can, and then internally rotating the feet as far as we can. We're doing this in a nice, slow, controlled fashion. We're repeating this 15 to 20 times. And it's not uncommon for the knee, if it is a little bit tight or out of alignment, to actually pop or crack as we do this. However, as long as there's no pain, we can continue to move through this motion. If there is pain at any point, please do stop and consult your chosen medical professional. Knees are a nice, strong joint. We shouldn't really have too many issues with knees. When we do have issues, it's very likely coming from the ankles or even the hips. Now, with that in mind, if your knees drop towards each other, it could be a flat feet type of problem, you're having valgus knee or knock knee issues, then you might want to check out this previous video that I've done on knock knees or valgus knees. Alternatively, if it's coming more from your hips, you might want to check out a lower back video right here that I've done previously, which will help you stretch and mobilize through those joints. And if you haven't already done so, hit the like button, click subscribe, tap that bell icon, do all of those things, and I'll see you next time.